Every year, around 12,000 people in the United States suffer a spinal cord injury.
Spinal cord injury has a broad spectrum and can range from a simple disc herniation all the way to compression of the spinal cord, either from tumors or from bleeding, gunshot wounds, and other things.
When a person sustains a spinal cord injury, their life is drastically changed. Things that they were able to do prior to their injury, they're no longer able to do, or they need assistance with doing it. They now have to catheterize, they have to use suppositories. In the very beginning, they need assistance with dressing, getting in and out of bed. It's a whole new education for both the patient and the family.
An individual with spinal cord injury can have lots of different kinds of pain. Because they've had a spinal cord injury, clearly, there's injury to the nervous system, and it can create what's termed neuropathic pain. But there are other types of pain that people with spinal cord injury often have, and they can be a result of overuse syndromes, like in shoulder pain, for example. If you use your wheelchair a lot and you're doing repeated motions, it can cause shoulder pain. There's also a lot of transferring from your wheelchair to the car or to your bed, and that creates a lot of pressure on your shoulder joints.
In addition, shoulder pressure and pain can result from incorrect techniques for propelling the wheelchair.
When a patient is now wheelchair bound, they're using their shoulders in a completely different way than whenever they're getting in and out of a vehicle. And a lot of them do eventually learn how to drive with hand controls. They have to now put their wheelchair into the car. Some of them take it apart, they take the wheels off the chair, and the chair folds up. And that puts a lot of strain on the shoulders that they never had before.
Up to 78% of spinal cord injury patients using hand-propelled wheelchairs experience shoulder pain.
The pain can really affect their quality of life.
For Miami resident Mario Moran, the shoulder pain was debilitating.
I was one of those that at the time had a very difficult pain in my shoulder. I couldn't sleep. If I wake up in the middle of the night to shift weights, it was just unbelievably painful. Pushing myself, taking the wheelchair in and out of my car was painful. Even shooting the basketball at the time was unbelievably painful.
Moran is a patient with the South Florida Spinal Cord Injury Model System.
The South Florida Spinal Cord Injury Model System is based at the University of Miami and Jackson Memorial Hospital. Every year we take care of a large number of spinal cord injury patients.
We have clinical services, we have research services, which I'm a major part of, and we have dissemination services. We provide education and other resources that are available to people with spinal cord injury and their caregivers and loved ones.
The Spinal Cord Injury Model System provides comprehensive care to patients with acute spinal cord injury through rehab and all the way into the community and lifelong follow-up. One of the aspects of providing comprehensive care that all the systems do is we collect data. We collect data on every new injured patient who consents to be in the model system and who goes through our comprehensive inpatient rehabilitation.
In addition to collecting data on patients, the South Florida Spinal Cord Injury Model System is conducting studies funded by the National Institute on Disability and Rehabilitation Research. One study is following patients for a year after their injury. The goal of this longitudinal study is to identify which patients are headed for shoulder pain and pathology.
We're trying to detect whether or not we can see pathology that would be predictive of having pain, because most of the patients are not having shoulder pain right after their injury in the first few months.
Ricardo Boza has volunteered for this study.
Well, I was heading home to go help my mom move. And on the way home, a block away, a car went to make a left turn, oncoming traffic, and I guess he saw the car next to me and didn't see me in my lane, and he just stopped in the middle of the street to let the car pass, and I ran directly into him, going about 40 miles per hour. I received paralysis from the chest down.
So in our longitudinal study of spinal cord injury, the things we're trying to see here is what is the natural history of the shoulders in persons who suddenly are faced with having to use a wheelchair. after a spinal cord injury.
A member of the longitudinal study team, Dr. Elizabeth Felix, is a psychologist specializing in the study of pain.
My role in the study is to make sure that we're measuring pain accurately and reliably in our patients so that we can see if there are any changes and be able to document them. Pain is a subjective phenomenon, so people will view the same kind of stimulus in different ways. So I might report it as very painful and you might report it as less painful. Just because a phenomenon is subjective, it doesn't mean that you can't measure it objectively. So there are a number of tools that you can use to measure pain. One of the very simplest ones is to ask a person to rate it on a scale from 0 to 10, where 0 is no pain and 10 is the most intense pain imaginable. And using just a simple scale like that, it's been shown that this is a very reliable and accurate scale, so that if a person first rates their pain at a 6 and then it goes down to a 3, you can be pretty sure that there's actual pain reduction there. How would you say the intensity of your shoulder pain is?
4.
4.
Sounds about
Okay.
right.
One of the instruments that we use to document pain is a pain diagram. So this is basically an outline of the body, and we ask the patient to indicate on the diagram where they have their pain. So we can see where the location is, how far it spreads, and any changes that might develop over time. When you're evaluating a painful condition or a chronic pain condition in a person, you don't want to just look at how bad is the pain or where is it located. You need to look at things like the quality of the pain, how they describe the pain. This tells you a little bit about what kind of pain it might be and how best to treat it. But the other things that you want to be concerned with are how the pain impacts their life. So a very intense pain in one person may be treated differently than a very intense pain in another person, because in that first person, they may be able to ignore it or cope with it in very appropriate ways, and they're able to get around in their life. But the other person who has the same intensity of pain may not be able to cope with it as well.
While Felix studies the experience of pain, Dr. Robert Irwin focuses on the physical causes of pain.
When we admit somebody to the study, we want to take a look at their tendons with the ultrasound machine. We start by looking at the biceps tendon to see whether there's any evidence of abnormalities there. Oftentimes, people who have shoulder pain from a rotator cuff problem will have fluid around the bicep tendon, and that gives us a good idea to begin with whether there's something going on. The second thing we look at is whether there are any changes to the bone that occur as a result of overuse. The third thing that we then look at will be whether or not they have a tear in the rotator cuff. This way we can get a look at the dynamic movement of the tendon, which is not shown by any other study that we can do currently. MRIs are just a picture, whereas we can get a video of a tendon moving and see if there's something going on. Until recently, ultrasound has not been as definitive as things like MRIs. MRIs are expensive, but with the newer technologies, we can now get almost as good a picture with the ultrasound as we do with the MRI. This allows us to do this study and be able to see minimal changes.
While scanning Boza, Irwin found a tear in his rotator cuff that hadn't been diagnosed before. The tear has been healing with conservative care, which means without surgery. Irwin hopes the study will help detect shoulder damage before patients feel pain, so that he can direct them to use their arms in such a way that pain never develops. One of his tools is called quantitative ultrasound, which uses software to detect damage in the shoulder joint that even his own trained eye cannot see.
When we take a picture of our tendons in the ultrasound machine, we then put it through a program on the computer. There are 9 different things that we look at that are really not something that the human eye could see, but only the computer can. And so we go in and we look at the exact same spot on the tendon, and we can compare it at 2 different points in time, thus allowing us to see whether these parameters that we have come up with through the computer are something that we can use in the future to be able to detect problems.
The longitudinal study is still in progress, so the results are not yet known. But if members of this research team get their wish, all new spinal cord patients will get a shoulder ultrasound soon after their injury to establish a baseline for their care and then follow-up scans every year. While the longitudinal study simply observes patients over a year, a second study at the South Florida Spinal Cord Injury Model System is testing whether a simple intervention can reduce or eliminate shoulder pain. Exercise.
In the exercise study, they all have shoulder pain when they first enter. All they know is they have pain and they don't know what's causing it. We're hoping that to show that the exercises help lessen or totally get rid of the pain for them just by strengthening the muscles and the tendons in the shoulder. We're doing the study just on paraplegic patients. It has to be some type of traumatic injury that has caused the paraplegia.
Suffering from a traumatic injury, Mario Moran qualified for the study and enrolled.
Out your shoulder.
It was May 27, 2005. Prom night, my senior prom night. I got shot at 11:33 p.m. The reason I know the time is because as I got shot, as I was falling, I picked up my phone and I started dialing 911. I remember picking up the phone and seeing the time, 11:33.
Moran was taught 4 simple exercises, which he then practiced at home for 12 weeks. Although the study is ongoing and results haven't been announced, Moran's personal impression is that the exercises helped his pain.
I felt better when after I did, I felt a better stretch. I felt after a couple of weeks of a little bit more improvement when in the middle of the night when I wake up, if I could shift my body weight, I noticed that my shoulder wasn't getting as much stress as they got in before I was involved in the study.
In fact, with the shoulder pain mostly eliminated, he's been able to pursue his passion, basketball, at a highly competitive level. It's a goal of the South Florida Spinal Cord Injury Model System to help all patients aim so high.